It's Dr. Andy here for your daily COVID-19 tip, and I'm wearing my Star Wars shirt because today I need to channel the wise sage from a long time ago in a galaxy far, far away, Han Solo, who said, "Great kid, don't get cocky." Now, what do I mean by this? There are a couple ways we can be cocky. Some are pretty obvious. I'm not going to address that one as much. It's more kind of the subtle ways that we can become confident and then maybe become cocky about our decisions and what we've done. So I'm going to use an example that is a hot topic, and that's mask use. I'm going to talk more about sort of the actual concept of mask use tomorrow in my next tip, tip number 7. But today I want to address the sort of just kind of the effects of making a choice and the feedback you get from that. And I'm using this issue again because it's been a very hot topic, and even though to me the science seems pretty clear and the guidance is pretty clear, all the way from Dr. Birx of President Trump's White House coronavirus task force through the CDC into the state and the local authorities. Everything that I've seen recommends using a mask when we're in public places and we may have interactions with other people, particularly within 6 feet. So even though that seems fairly consistent, it's become a pretty divisive issue. So I want to talk about some of the effects of that. Again, the specifics about using the mask, check in tomorrow. Now, let's talk first about our risk of getting sick. Okay, so my risk, and so if I choose not to wear a mask, then does that mean I'm going to get sick? Let's talk about that. So what's my chance? I'm going to use data from Arizona because that's where I am. So in Arizona over the past week, about 2,100 people are getting sick. Let's say that number stays consistent and the risk is about 2,100 people a week getting sick. Now in Arizona, we have a total of 7.28 million people. So what is my risk in 1 week of getting sick? That comes out to about 0.03%. And that seems pretty low, right? My risk of getting sick. And that's if I just go out and interact with people. Now, of course, there are public health measures being put in place and that's affecting the number. There are a lot of assumptions here, but let's just say that this is accurate, okay? So my risk is 0.03%. Seems pretty low. Now, if I choose not to wear a mask and I go out and I get and I don't get COVID-19, the statistics were way on my side. It may have very, very little to do with my choice about my behavior and much more to do with the statistics. So why is that important? Because if I let that affect my decision making and think, hey, well, see, it wasn't a big deal. I didn't get sick. You could become cocky from that, and that's an issue. I still absolutely recommend what I discussed as the major way to fight infectious disease, discussed first in tip number 5, about isolating or identifying individuals, so through testing primarily, isolating them, tracing their contacts, and quarantining their contacts. That's the way that we know to fight disease. And then we have additional public health measures to help with that, like wearing a mask. And so I recommend following these public health measures. Why? It may not affect my experience that much, but it will help the public do better. It will help less people get sick, and it will help less people die from this. So that's why I recommend that. So for those that may make a choice and feel like, hey, see, it didn't affect me, while there may be true, we each do have to come to an understanding of what our risk is and accept our risk and go on and live our lives the best way we can. In those measures where there's some science to say why somebody should do something a certain way, I would say even if things turned out on your side and you think that it worked out well, great kid, don't get cocky.